As we age, some people experience signs of dizziness, blurry vision, and fatigue, all which can throw you off your physical balance. And it's important we know if it is something rather that we can sleep off, or if it's a sign of something more serious like vertigo. Dr. Alicia Brown and Lauren Brindisi from Better Brain and Body are here tonight to shed some light on this. Welcome to you both.
Thank you for having us.
First to you, Dr. Alicia, can you explain what vertigo is?
Yeah, absolutely. And there are so many actual types of vertigo. One of the most common types of vertigo we see is BPPV, or benign paroxysmal positional vertigo, where the crystals in your inner ear get loose, and you can feel like there's motion that's not actually there. So you feel like the world is spinning when it's not, in fact.
Who knew that there were crystals in your inner ear that could get loose? So what are the signs to let you know that this is vertigo and it's not something else?
Yeah, so a lot of our patients will complain not necessarily of feeling like the world is spinning. That's the most classical reason that you might have vertigo. A lot of them may say, oh, I tip my head back in the shower and all of a sudden I'm off balance. I feel like the world is spinning around me. But we see some patients who aren't having that classical version of vertigo, but they say they feel swimmy, they feel nauseous in the car, they just feel off balance when they're doing things. Those are some of the really common signs that we see for patients.
So how do you detect vertigo and not confuse it with other disorders?
Well, the diagnostics that we do in our office really help us pinpoint those. We can actually put patients in infrared goggles and see what their eyes are doing in the dark, which you can't see otherwise. And we can see if they have something called a nystagmus, where their eyes are moving slow and then beating away, and we can check their head in different positions again to see which specific canal might be affected, or if it's something different. Again, Dr. Brindisi talked about feeling swimmy-headed, or like you're on a boat, and that we'll see eye movements that just jump back and forth.
Okay, so we know the cause of vertigo. How can you treat this?
Go ahead. We do many different treatments in our office. You just saw some pictures there. We can do repositioning maneuvers if it is a BPPV. We do head-eye movement therapies where we might have a patient concentrate on a certain target. We can do some interactive metronome training, which your cerebellum is very tied into timing and rhythm. We do things using the motion guidance, where we can actually give the patient visual feedback of where their head is in space and how they're moving.
Yeah, so a lot of this is really dependent on the examination. A lot of the patients that we see who have vertigo tend to head injuries, some type of car accident. A trauma is a really big reason people will come with an acute type of vertigo. So vestibular rehab, repositioning maneuvers that we're actually able to reposition how these crystals can fall out of place into the different canals and give you this perception of motion that isn't there are really helpful for patients. And when we can get them really soon, that is the best, because we can usually fix this really, really quickly.
Okay, I was about to say, about how long?
If it is a BPPV,
which stands for, I'm sorry?
Benign paroxysmal positional vertigo. So that is the #1 cause a patient will have vertigo. And we can usually, hopefully, if we fix it in one visit, if we get them soon enough. If not, the brain creates plasticity from that aberrant movement that they're getting, and then it may take a little bit longer because we need to do more neurological rehab to actually rewire how the brain has adapted to that change.
So as soon as you're feeling this, you need to reach out.
Yes, absolutely. Please. And actually, if we have a second, Dr. Brindisi can tell you a story about herself recently walking her dog.
Yeah, so I just recently had a branch fall on my head after a storm, and just a couple days after that, I started having vertigo myself.
Wow.
So luckily I understood what was going on, and Dr. Brown helped me immediately, and within an hour the vertigo is gone, and I've been fine ever since.
Yeah.
So if people want to get in touch with you, how can they do that?
They can call our office, of course, and we always give a free 15-minute consultation. We understand, we see people years after, people that have been suffering for years with this, which is so, it hurts us really to our core, because we can help people so fast. But a lot of people have been to a lot of other doctors and practitioners, and they don't know, they've spent a lot of money and they don't want to double up, or have you already done
Little
this?
hesitant,
right.
right.
So we always do a free 15-minute consultation, either over the phone or in the office, and we'll talk to you and see what we can do for you.
For more information, you can go to WBTV.com, look in the Web Extra section right there on the homepage. Doctors Brown and Brindisi, thank you so much for being here tonight. We appreciate it.
Thank you so much for having us
Thanks
again.
for having us.
Absolutely. I want to get back to our Sound Off Charlotte topic now, if we can.